First responders with American Medical Response say a change is needed to address a paramedic staffing crisis. They tell us the rate of emergency calls is going up while applications for paramedics are on the decline.
This comes as data from our media partners at Willamette Week show ambulances have been unavailable about 10% of the time in Multnomah County so far this year. That equates to more than 5,000 calls. Right now, the ambulance provider and the county health department are at odds around how to address the challenge. KATU's Megan Allison joins us live now outside of AMR's Portland location.
So Megan, staff they're proposing shifting from a model of 2 paramedics on every call to a mix where some calls get a response from a paramedic and an EMT. So why does the county disagree with this?
Well, Deb, staff with the county health department tell me they agree that EMTs are an important piece of the puzzle, but they say when emergency vehicles leave this location, they need to be strategic to provide care. Staff with AMR say the change they're proposing is temporary. The Northwest VP of Operations tells me by allowing a mix of EMTs and paramedics to respond, they could staff 5 more ambulances a day within the week.
Our response times are very substandard because we're probably short 8 to 10 ambulances a day of where we want to be, but we just don't have enough paramedics to staff them. I asked the Multnomah County Health Operations Manager why his team is not considering this change right now.
We believe that there is a spot to use EMTs in the system, but we have a difference of how we want to use those. We think that it would be better to use those on 2 EMT Basic Life Support ambulances.
Currently, a paramedic still has to respond to a call, and only they can deploy a Basic Life Support ambulance from there.
Or why not make a change to address what's going on right now?
There's a small number of calls that are really critical patients where you really need those 2 paramedics on scene working together.
Commissioner Sharon Myron says right now she's advocating for county leaders to make this change.
As we go into the summer months, we see even more people needing ambulance services. And with the fentanyl overdose rates and we're just seeing crises of epic proportions.
Staff with AMR tell us there are currently about 30 people in EMT school in our region set to graduate in about 2 years. AMR says if 911 operators could directly dispatch basic life support with EMTs instead of paramedics first going out to vet those patients, that could also have a major impact on response times. We're live in Southeast Portland. Megan Allison, KATU News.
Megan, thank you.